In today's episode, we are going to talk about some of the misconceptions and answer some of the questions that you've had about breast cancer and the causes, effects, treatment, and all of that. My name is Stella Chijom Sudli. I'm seated with a general practitioner at the Medifem Multi-Specialist Hospital and Fertility Center to bring you the answers you've been waiting for. Don't go anywhere. We'll be right back. You're welcome back. And I have with me Dr. Mends-Armstrong. She's a senior medical officer at the Medifem Multi-Specialist Hospital and Fertility Center. And as usual, hello, Doc.
Hi.
So first of all, when someone sucks your breast, does it prevent breast cancer or reduce your chances of getting breast cancer?
Right. So this is something we've heard a number of times,
Yeah.
especially the men
Yes.
interested in that, asking if sucking our breast is going to prevent breast cancer. No. So the thing about that is when a child, so it's not about breastfeeding, when a child sucks your breast, I mean, it's a whole hormonal cascade and all of that. That's what we are talking about. The hormones that come about because of breastfeeding that protect you from breast cancer. So we encourage women to try and breastfeed for at least 6 months when they deliver. But for the men, no, there's not about them at all.
Oh, that's a very disappointed no. But okay, sucking the breast does not reduce the risk of getting breast cancer.
The breast being sucked by an adult man,
Okay,
no.
so breastfeeding helps.
Yes.
Okay, so it's advisable to breastfeed your child.
Yes.
What about those who just extract the milk for those mothers who use their tube to extract?
Express,
Yes.
yeah.
How about that too? So that's just opposed with breastfeeding.
Yes, so it's the same mechanism really.
Okay.
The breast pump, the child, they are pulling on the nipple, they are stimulating your brain to release certain chemicals. It's the chemicals we are after. Those are the chemicals that protect you from getting breast cancer. So that's really what it is about. The hormones or the chemicals that come out from that.
Should women wear braziers all the time?
All the time. Okay, so the thing about wearing a bra is that first of all, breast tissue is, we all want our breast to look full and, in the right
Organized.
place
Yes.
all the time.
Organized.
There's also gravity as we are walking around that pulls things down, right? So if you leave your breast hanging all the time, at a point, gravity is going to, over years, gravity is going to make them sag.
Okay.
And you really don't want that. So that's the top reason why I would advise anyone to wear a bra, a well-fitting bra. It would surprise you, 80% of women don't know what their bra size is. So today we are telling you to go out there. There are so many fitting shops where you can get your bra fitting done so that you know exactly what size you are. Then you wear a proper fitting bra just to make sure that your breasts look good all the time. If you want over the long period, your breasts to stay in place.
Okay.
Yeah. So yeah.
Does it have anything to do with getting breast cancer if you wear tight or too loose? Does it affect tight clothing, tight bra?
No.
The duration that you wear braziers for?
No.
Wearing braziers all the time, like you wear a brazier for more than 8 hours a day. Does it have any effect on your breast?
In terms of breast cancer, no.
Okay.
Wearing your bra for hours, it's not going to give you breast cancer or even put you at risk of getting breast cancer.
Okay.
No. Like I said, the whole issue of wearing a proper bra is to make your breast look good all the time, to prevent it from sagging over a period
How
of time.
about hygiene?
Hygiene, in general terms, excellent for everyone. You don't want to look or smell bad. If you wear your bra for a very long period of time, sweat and all of that, you start to smell bad. So then you should change your bra often, every day, and then wash your bras. Yeah, but then really breast cancer, no.
Are there physical things that can cause breast cancer, apart from things that you take within and genetic factors?
When you say physical?
Physical, like death, or maybe you have a cut, maybe something, you are exposed to certain chemicals because of your line of work or something?
Yeah, chemical exposure, being exposed to chemicals, some kind of drugs. Okay, so in some pharmacies, those that work with especially the cancer drugs, you see them suiting up before they handle them.
Okay.
Because all of that, so germs, no. Infections and things, no. If you have repeated breast infections, some people get that. Over a period of time, that could predispose you to breast cancer. Because when you've got an infection, the tissue and all of that replication, what in the first video what we spoke about, the breast tissue growing out of control. Yeah. So that's where infections come in. But that's repeated breast infections or breast disease. But then death in itself, no, will not do that. Chemicals, yes. Unfortunately now we are exposed to so many chemicals. Even the meat that we have, we've heard of people giving hormones and things to their livestock just to boost production. And this is also exposing us to a lot of those things through the food that we take.
Okay, so I asked that because these days you see a lot of people wearing clothes that expose their breast. So exposure to environmental factors, does it have any relation to giving you breast cancer?
For that, no. The only thing I'll say about breast exposure is that if you're going to expose your breast in this sunny part, we keep hitting on sunscreen to protect. Yeah, so if you're going to expose, just smear some sunscreen as well. Just protect your skin. But that aside, you're good to go.
Okay, so we've also heard of deodorants, spraying your armpits too close to your breast over time. Does it have any effect?
Depends on the chemical that's in your deodorant. So it comes back to chemicals. If, some of these deodorants have some metals, aluminum something and all of that. And that, over a very long period of time, is going to lead to oxidative stress, exposure to free radicals and things like that. And all those things predispose you to any form of cancer at all. Yeah. So I'm not saying don't use spray deodorant, but then you should be sure of what you're using, what the components are. Yes.
Okay, so let's talk about men. We know that men also get breast cancer, just that they have low chances of getting it. So men do not have the tissues that women have. So how do they check for breast cancer, or it's only men who have bigger breasts?
So breast tissue itself is standard, or is the same for both men and women. For us, what makes us more pronounced is the fat that collects in it. Yeah. So the basic anatomy, the cells and all of that, they are the same, although more developed in women because of how they serve in child making. So for men, yes, they could also, regardless of how flat or raised theirs is, can also feel a lump or even have the skin changes, sores and things like that. So they also must feel to make sure that they don't have any lumps. Like you said, incidence in men is much lower than in women, but we have a couple of men that have survived breast cancer.
Okay, yeah. So does pressing of the breast also help to reduce?
Pressing by who?
Pressing by anyone. Especially during sexual activity. Some people try to, for sexual pleasure, touch in certain kinds of ways. Some people press. Yeah, does it do anything? Does it help you?
So, does it help in breast cancer? The only way I see that helping is if your partner, so this is assuming that you've got one sexual partner and this person knows how your breasts feel, okay? So then he's going to be able to detect small changes. Oh, today I felt this here. Let's have it checked or something. That's the only way I see this helping us with breast cancer, to detect that. Apart from that, if it's something both of you enjoy, go for it. But if not, it's not going to do much.
How much pressing is too much?
How
Will
much
it
pressing?
have any effects? Or...
Oh no. No.
If it's not painful.
If it's not painful and you are enjoying it, it's okay.
No problem at all.
No problem at all.
Touching the breast does not
no.
any way.
It won't. As long as you're enjoying it, please have fun.
Okay. Thank you very much. And how different are... I've heard that it's not every lump that you find in the breast that is cancerous. So how different are those lumps that you find in the breast from the cancerous ones?
Okay. So first of all, any of these lumps can come at any size, whether cancerous or not. Okay. But for breast cancer, they tend to be hard, very hard. Very, very hard.
Pronounced hard.
Yes, stony hard almost. I mean, as it gets worse, it becomes harder, but then they are hard. They can be attached to the skin or the muscle that is under the breast, right? So then it becomes difficult to move it. Okay, yeah. And then for some of them as well, where the lump is, you start to get a sore. Okay. So those are some of the things that point to a breast mass being malignant. But then if ultimately it's a biopsy that will tell whether it's a cancerous lesion or it's not, whether it's a breast cancer or it's just any other breast lump.
So it still goes back to going to the hospital.
To the hospital, yes. You can think that you've got a breast cancer, but then you're better off going for it to be confirmed, as against staying at home and then worrying for the wrong reasons.
Okay, so does it affect any other organ of your body? Like you just got breast cancer, can you get other cancers in your body just because you had breast cancer?
Yes, having cancer anywhere in the body, breast anywhere else, the big problem with any of that is that it can move to other places. That's what we call mets. Okay, it can move to any other place. So you can have the primary cancer in the breast, but then eventually it's going to move to the lungs. It's just going to spread throughout the body, right? So yes, if you have breast cancer, it's detected early, you do nothing about it. Even sometimes detected early, you are working on it, but then it starts to move to other places.
Okay.
And then, I mean, it becomes something very terrible, yeah.
So it still goes back to early detection.
Early detection.
Okay, so checking your breast, how should it be done?
Yeah. Okay.
And how often? Like, is it an everyday thing? Or?
Let's start with the often. So first of all, I said in the beginning that we want you to be aware of your breast, what your breast look like, what your breast feel like. So as much as possible every day, I mean, you're going to take a shower, just take a look at your breast, the skin, the nipple, has anything changed? Some people already have or are born with nipples that are turned inwards. But if yours isn't that way, take a look. Is it looking that way now? The skin, are you seeing something like the orange peel? Okay, hood orange, as we call it. Are you seeing any sores, any reddening at any parts, any thickening? The skin looks thick. Then you feel it. Are you feeling any lump in your breast? Okay. Look at the nipple, any discharge from the nipple. Right, so these are things you have to take note of every morning. But the best time to examine your breast properly is after your period. Because, you know, when you're about to get your period, your breast becomes a little heavier and thicker. Yes, so then it might be misleading. You might think that there's a tumor when there isn't. But after that, then things have gone back to normal, so to speak, and then you can feel properly. Okay. Yeah, but check every day, look at it every day, but then best time is after your period.
Okay, and the how?
The how. So if I'm going to attempt to use mine,
okay.
But then if you look at any breast at all, right, you can divide into 4.
Okay.
Right, so one line up and down through the nipple this way, then the other line through like this. You touch, it must be flat. You are touching flat. We are not poking or grabbing, right? You are using the palm of your hand, like this side, the flat of it. And you are feeling, you are pressing against the chest wall. Let's say this is the chest wall. Then you've got the breast sitting on it. If you just press like this, you are pressing the breast against the breast. You might think there's something there. But then against the flat part, you move gently. So you take every quarter, you've cut it into 4. So you go gently, this side as well, this side as well. If you feel anything, okay, there's something there. And then you don't forget the nipple in the middle, right? You press on it as well and feel. And then you try to squeeze the nipple, see if any blood or something is going to come out of it. And then don't forget the armpit, because when it starts to spread, it travels into the lymph nodes in the armpit. Then if you have any swellings in your armpits as well, that could also mean that let's have this breast checked. Yeah.
Okay. Okay. Right. It feels like I'm in awe. But thank you very much. I've had most of the misconceptions in my mind cleared, and I think that it's been a very fruitful discussion. Thank you very much, Dr. Mengs.
Thank you too.
For having us. And that will be all for today's episode of our breast cancer awareness creation month series. My name is Stella Jejom Sudli. Thank you for watching.